We are back at Trinity Health. We are with Jacqueline Kane. She is the director of rehabilitation here. That is a very big umbrella. Today we are talking about outpatient services. Let's run down the list of all of the things that you offer patients here. It's a long list.
It is. So the nice thing about what we do here is we have a lot of locations. So for outpatient specific, we have 3 specialty locations here in Muskegon. But 9 outpatient locations that offer general practice between physical, occupational, speech therapy, and athletic training services along the entire lakeshore. So if you think about therapy services, a lot of people don't realize what all that encompasses. So a few of the basics, you know, we're here for general pain, your chronic pain, your back pain, headaches, neck pain, basically any musculoskeletal or orthopedic needs. But for occupational therapy, we do things for like fine motor skills, vision treatment, things like that. And then speech therapy, what most people don't realize is it's not just about how you talk, it's swallowing, it's cognition, it's recalling your memory. There's just so many different things that we can really offer in the rehab services.
Yeah.
It's really nice.
It's wonderful. And then it's all conveniently located around here on the lakeshore, and people can kind of pick and choose where they need to be. So let's talk about what different things would bring someone into rehab.
There's your obvious, right? So if you're in a car accident and you're injured, there's so many different things that could happen. Maybe your balance is off, maybe you're not walking right, maybe you hurt your ankle, maybe you had surgery. So you can have therapy services for those types of things. But concussion services is a huge problem. There's so many athletics going on along the lakeshore here. I mean, football is a huge thing in West Michigan, and concussion's a hot topic. So not many people realize you need physical therapy services, you might need occupational therapy services, as well as speech therapy for a concussion. So that's a car accident, you know, an athletic accident, any type of injury, overuse, whether it is acute and you slipped and fell on the ice, or you've been dealing with back pain for years. Our therapy services can really help in all areas.
Yeah, and obviously we're talking about lots of different kinds of therapy, but if a patient is coming in for an outpatient service through rehab, what do they expect? What should they expect?
At any of our Trinity Health locations, you're going to get personalized and individual one-on-one care. So you're going to come in and you're going to meet with one of our therapists, whether that is physical, occupational, or speech. You're going to be fully evaluated, and they're going to determine what's your next step, right? So what do you need? How do you get back to where you want to be at? What are your personal goals? They're going to do a full, thorough assessment and determine where your deficits are and have a great conversation with you about what you need out of this and where they think they can really get you. Ideal state, we always want somebody to be back to as independent as possible. The realization is you're not always 100%, but we're going to get you as close to that 100% as we can. Our treatments are always going to be one-on-one. It's very individualized and specialized to you and what you need and what your goals are. And you know, they might come and develop a plan that is 1 time a week, 3 times a week. It all depends on what you're coming in for. And I think the biggest thing about outpatient therapy is it's very patient reliant. So if you're not willing to put in the time and the effort, it's really not going to work. You have to come in, they're going to educate you, they're going to provide you with home programs, but you have to be willing to do that in order to make progress and make yourself better too.
I think that's really important to hit on, absolutely. And so how would a patient end up in this program? Is it all referral?
No, not necessarily.
Okay.
There's a lot of insurances in Michigan that allow direct access. What I would tell any patient and anyone considering therapy, talk to your provider. And if you think therapy is a good way to go, they can send us a referral, not a problem. But if you do have questions, we have services as far as consult lines, and we do free injury consultations. You can go to any one of our clinics, do an injury consult, and our therapists are going to say, okay, you know what, I do think therapy is best for you, or actually, you're really going to go need to see a provider first and work with them. We collaborate very closely with our providers and make sure that we're giving you the best possible outcomes and the best possible next steps. And that goes for any of our service lines. But we're never going to take you if you need a referral. We'll help you get the referral set, and we're never going to make you do the extra steps if they're not necessary. So we do a very good job of collaborating with the patient, with the providers, and just making sure that you're getting what you need out of it.
Wonderful.
And if it's not us, that's okay too.
Well, absolutely. Gosh, what a valuable service for the community. So if someone's out there listening to this, you know, perhaps they think they need to come and get some therapy, what do they need to do?
You can always go to our website, so trinityhealthmichigan.org and then /rehab. We do have a central scheduling number too, so if you call 231-672-4800 and hit option 2, it's going to send you to our rehab schedulers, and they schedule for all of our locations and all of our specialties. So whether it is general rehab or you need lymphedema, wound care, special needs car seats, we do all of the above, and our schedulers are going to help get you to the right locations.
All right, perfect. Thank you so much, Jacqueline. We really appreciate it.